course, the philosophy is that people do business with the people that they love and they like, and we must remember that case acceptance will go up if they are dealing with a friend rather than dealing with an employee of a business. And so I've always got my staff to work on the relationship that they were friends with the patients first and foremost, and that built us a very, very successful business. So let's have a look at building block number one, the ultimate connection. Briefly, you can see that there's an entrance point for new patients on the right, for existing patients on the left, a couple of extra steps in the entrance points on the right, but your advertising and your method of referral has to back up the philosophy of the practice, has to be consistent. Patients call in or email or SMS, or they walk in, or in some parts of the world, like Byron Bay, they have telepathy, but they end up scheduling an appointment. For new patients, we might send them some information. If we don't, we put them in a loop where we follow them up, send them more information, keep in touch with them till they make an appointment, and then we have pre-appointment contact, and then we also have pre-appointment confirmation. And it's at each one of these steps, we've got to know what we've got to do, what we got to not do, how to fix anything that could go wrong, and where we can go above and beyond their expectations. Because if we don't frame up that new patient call to the practice, those people get off the phone and go, that wasn't really that good, I'm going to look for somewhere else. So for those of you sitting down the back of the auditorium, there's a Excel of that, but really it's how the phone is answered first and foremost. The phone has to be seen as an exciting part of the day, not an interruption, and when it rings, we've got to be answering with a smile. The person who calls us has to believe that we've been waiting for that phone to ring all day, and we've got nothing else to do but to serve them and solve their problem. We don't want to be giving them the thought that they have been an interruption at all. And I find that a lot of dental practices don't look at what their staff are doing, and so I often find that at the front there is a big problem. And I walk into practices and I see patients sitting in the client lounge out the front, a front desk, somebody hiding behind a big computer screen or a desk, texting on their phone or talking to another staff member. In fact, I saw one practice where two staff members were talking about a third staff member who wasn't even there, and about that person's social life in front of two live patients waiting to go in. And I thought, this is not building a good relationship for the practice. So I always ask the staff, is what I'm doing now helping to build relationships with patients, or is it sending the patient a poor message about our practice? And is what I'm doing now so important, or can I put it aside, talk to and engage with my patients in my waiting room right now? We need to be doing that. And I ask the staff this: if I was the patient, how would I feel about this business witnessing the behaviour in front of me right now? Because I wouldn't be too happy, you know. If the patient's not paying, maybe, but it's still not a good way of keeping patients. But if patients are paying, you should be bending over hand and fist, bending over backwards to make sure that that patient has a great experience before they go in to have their dental treatment done. So you've got to be wowing your patients ahead of time when they call, not just putting names into slots in the appointment book. And I find this with clients all the time, that their dental receptionist thinks that their job's done. Oh, I saw a blank space, so I put that lady in for an adjustment. Now, guess what? The appointment book's full. Well, it's full of adjustments and eases and high spots. And guess what? The dentist goes home, he's worked short appointments all day long, and he goes home and he might be lucky if he's collected $1,000. Not the smart way of building a dental practice of your dreams. So as you saw, there were 3 cycles. Back to the receptionist. They're not to be just scheduling appointments. They've got to be making appointments, making their day, make the person who's called day, so that when they get off the phone, they are so looking forward to that appointment, they wouldn't even consider ringing anybody else, and they're hoping that you're going to ring and bring their appointment forward. That's what we want when somebody rings your dental practice. So remember, again, those 3 cycles. Let's look at the treatment cycle. You see the colours of the cycle match the colours of the building blocks. So the second building block was the ultimate arrival. Same 3 steps for all 3 cycles. How's the arrival? That's the physicality of your facility? Is it clean? Are there weeds in the garden? Does the pathway need a sweep? Does the front door need a clean? Are there fingerprints all over it? Are people checking this throughout the day as well? Are people even entering from your team, entering through the front door and noticing this sort of stuff? Are they picking stuff up if they see it? I've seen staff walk in and leave rubbish outside. Oh, not my job. Well, guess what? It is your job to make sure that your business is presentable, because somebody walks up and sees rubbish out the front of your practice. Doesn't matter if you're the greatest dentist in the world. They're going to think that you're dirty because the front of your building's dirty. How are your patients greeted when they come to the front? Remember, the receptionist knows who's coming in. We've got a map. We've got a timetable of who's coming in for an appointment. So in my office, the aim was to greet the patient before they introduce themselves, even for new patients. We know if somebody walks in around 2 o'clock and we've got a new patient coming, that there's a good chance it's going to be Mrs. Smith, because that's what it says in my book, Mrs. Smith, new patient. And so lady walks in and we would say, hi, you must be Mrs. Smith. My name's Jane, spoke to you on the phone. Welcome to Active Dental. How's your day been? Now, isn't that much better than Mrs. Smith walking in and dinging a bell and somebody coming up and saying, can I help you? Well, of course we can help her. We know who she is because we haven't seen her before, so we're figuring she wants to make a dental appointment or she's there for a dental appointment. Chances are somebody in the book is new. Let's not treat people like we don't know who they are going to be. Try to anticipate who everybody is. Try to beat the greet. Last part of the arrival is, as I said, the hang time. I like to think of it as hang time rather than waiting time, like you're hang gliding, like you're really soaring up there and really enjoying yourself throughout the time before you go down for your treatment. The old days dental practices look like this, little window that you poked your head through, but still, even the radiology practice that I get referred to for shoulder checkups, they have a sign like this, 10 feet from the front desk. Please wait here. Now, sign's stuck on a ruler, and they say they've actually gone and printed it off in a Word document. Please wait here until you are called to the reception desk. Thank you. No punctuations. And so you wait there. It's almost like no soup for you. And one time I made an appointment and they said, can you come in 15 minutes early? I thought, oh, this is great. You know, they're going to prep me before I go in for my x-ray. No, brought me in 15 minutes early so I could stand at that sign and wait 15 minutes while they talked among themselves, looked at their screens and pretended I wasn't there. And it's really not a nice way to be. In fact, this radiology practice, they actually have a sign at another part of that desk. I had to zoom in on this and blow it up, but this sign was for the staff. It said, unless you are staying on the desk permanently, do not, underline, remove this sign, thank you, exclamation mark. Because on the other side of the sign was a sign to patients coming out from having their x-ray to tell them to go back and stand in front of the sign with a ruler. So my philosophy is that if you have signs in your practice, pull them down. Anything that's written on a sign, you must be able to say with words without having to say it with a sign. Simple as that. So make sure that the people in your waiting room don't look like this, because this is what they look like in a lot of practices. They are unentertained. They are not connected. And of course, if they're like that, the dentist and the staff down the back then have to lift them up to try and get them to accept treatment. So the people at the front have a big influence on what's going on. How are we going? We're going pretty close for time. If you could bear with me, thank you. How is the next one, the ultimate pre-appointment. Work out how you bring people down to your treatment rooms. How are they greeted by the dental assistant? How are they greeted by the hygienist? What do they say? Do you have a script? Do you know where that patient is? Can you walk out and straight to that patient rather than walk out a door and call out a name as if you're calling in a paddle boat? Because that's what a lot of practices do. You know, again, if you know that Mrs. Smith is the new patient and you've been told she's going to be sitting in chair number 4, the dental assistant can walk out and say, hi, Mrs. Smith, my name's Kyra. I'm going to be helping Dr. Moffet today. How's your day been? Can I carry your bags down? Are you ready to go? Isn't that much nicer than just screaming out a name out of a loudhailer, which is what most dental practices do? Point of difference. How about transferring the patient to the treatment room? Remembering that only 7% of what we say is words. The rest of it is tonality and body language. And so if you're walking beside, behind, or in front of a patient, you're missing out on the tonality and you're missing out on the body language because you're not face-to-face with them. So we worked out the best way to get the patient down to the treatment room, put them in a chair, sit down with them face-to-face, start the conversation there, because the conversation with the patient is so powerful. The other thing about transferring them down to the treatment room, you saw that picture of my building there. It's a pretty ordinary looking building. That's another story in itself, Jack. But we had a long hallway from the client lounge out the front to the treatment rooms down the back, and so that hallway had doors off to the staff room. We didn't want the patient walking past seeing somebody munching on a hamburger or a big pile of dirty dishes in the sink. Didn't want them going past my office and seeing me on the phone or on my computer, and other treatment rooms as well. So we wanted to make sure that we had the protocols right so that the patient got the best view of the practice going down to the treatment room. The fourth building block, this is really important because the one in the middle, the treatment cycle, you can see there's only 3 things that the dentist has to do. The dentist has to greet the patient, treat the patient, farewell the patient. And a little bit more complicated with the hygienist and how the dentist and the hygienist interact there. And that's, again, another lecture in itself, because you can really train your hygienist to be more than just a cleaner of teeth. You can actually train them to identify defects, show the patient, take pictures of the defects, tell the patient what the dentist might do for those, and answer questions for the patient. The hygienist could do that, and then the dentist comes in and confirms what he's going to do. Lot more productive. Hygienists can be very productive in helping with treatment, and I found that a well-trained hygienist is worth her weight in gold, and no matter how much she weighs, sometimes more. So we need those procedures there, but remember that the cycle is big and the dentist only has a small part to do. So the team all of a sudden realize that they have a big part to do. Remember that cycle too, there's no snakes and ladders. You can't go across and up and down. You've got to go round step by step by step. It's kind of like getting dressed in the morning. Can't put your shoes on before you put your socks on. Can't put your trousers on before you put your undies on. So you've got to do everything in order. The final building block is probably the most important one, and this is the same for each of the 3 cycles. How do we transfer the patient to the front office? How does the dental assistant do a handover at the front desk? How does the front office person respond to that handover? And of course, that has to be done in that order. You can't have the front office person taking over the handover before the handover has actually happened. It's got to be done in that order to maximize case acceptance. And if it's not done in that order, you reduce the chances of the patient coming back because you confuse the patient. A confused patient doesn't make an appointment. They say, look, I need to think it over. I need to talk with my husband. Whereas a patient who has clarity, and that's what we want to do, is create clarity for our patient. That patient knows when they leave this practice, they know what they've had done, they know how they're going to feel after the appointment, they're going to know what they're coming back for next time, they're going to know what treatment they're going to have done next time, they've got to know when exactly they're going to have that done, they've got to know what will happen if they don't get it done, and they want to be ready for your call to bring that appointment in sooner. Every patient. Now, one of those DVDs actually, CD sets actually explains that, and if you can get your team getting those handovers right, guess what? You don't get the cancellations, you don't get the people not making appointments, you don't have to do the follow-up calls, you don't have to do activation calls, because patients are keeping their appointments and wanting to come in. Wouldn't that be great in your practice? So it all comes down to that handover. After the handovers, of course, then you've got the checkout, the farewell, and the TLC. Sorry, I'm talking really fast because I want to get through it. The handover is the most important part. Just explain that to you, and yet so many practices drop the ball. They automate the handover. From the receptionist gets the patient brought out. They've written something on a piece of paper. No words are said, so there's no correspondence. And then the receptionist says, well, look, I'll just wait till the notes come up on the computer. And guess what? The patient is checking out. They're waiting. Everybody's waiting for the automation to kick in. Patient's reading their phone. They're distracted. And of course, the importance of the treatment, gone. Ball is dropped. So for each of those 57 stages, you've got to define those stages, and then you've got to define what goes on in those stages. And a simple page like this for each team member to then work out what they do in each of those stages. So the dental assistant who's responsible for taking the patient down the back will prepare what she does in that situation. What are her operational standards, her experiential standards? What are the defects that can occur? And when we know the defects, we know how we can fix them. How are our above and beyond opportunities? So operational and experiential standards. An operational standard is really a task that any dental practice would do no matter where it is, whereas an experiential standard is one that your practice does as routine, but other dental practices wouldn't even consider doing it. That's what sets you apart. And if your staff know that these are your standards for each and every step that the patient goes through, then it becomes a system rather than a haphazard thing of, yeah, we must say thank you, we must do this. No, it has to be systematic, has to be well thought out. Patients understand when they are part of a systematic process. Above and beyond experiences, simply random acts of heroism providing legendary service to the customer. If we can work those out in advance and everybody knows what they've got to do, we can kick in those above and beyond experiences, and patients just go, wow, how did they know that? But they know that you have tried to be systematic. Offer the offer, that is simply a matter of where the opportunity of making an offer that is rarely taken, where the offer of the offer is just as good, if not better, than doing the offer. So simply a good example, I used to give the patient a private business card, made up business card with my private phone number, with my private email address. They could put it side by side, looks very similar to the practice card, but different, but it's made up. It's not one with my number scrawled on in a texter. No, it's an official card. And I would say, here's my private business card. So after I'd taken out a tooth, extirpated a pulp. So look, I'm not expecting any trouble, but occasionally some people might have a couple of questions. If you've got a question over the weekend, contact me on my mobile phone, send me a message, leave me a message, send me an email. I promise to get back to you by the end of the day. I might be playing golf, but I will get back to you. Well, guess what? I would have given out thousands of those cards over 15 years. And I think on less than 5 occasions was I called by patients with a dental problem. So that was a great offer, the offer. How can we offer to walk the patient to the door? Can we offer to wait downstairs with them till their taxi arrives? Can we offer to carry their bags? No, thank you, I'm fine. Offer the offer, because the problem is we don't offer, and then the silence kills our business. So think of ways that you can offer an offer. Know your service defects. Defects are defined simply as an obstacle or challenge that can occur at any stage that can ruin the customer's experience. If we know in advance what they are, then we know how we can do service recovery on those things. We've got to know that list of things that could go wrong. So here's an example. Happened actually not in my practice, but while I was working in a friend's practice, the patient's crown had disappeared. We knew it had arrived at the practice, but somehow it had disappeared. And so simply what I did was, had to take a new impression. So I sent the patient a card. I said, "Hi, Robert. Sorry again for the mix-up about your crown. Thanks for understanding. We're lucky to have great patients like you. Hope that luck rubs off on this scratchy," and I threw in a $10 scratchy. So even if he was telling people, for a day that that we'd messed up about the crown, after that day he's telling people about the scratchy that he got, and hopefully he won. And I did that out of my own kick. I didn't ask the practice, because that's what I used to do in my own practice. Simple recovery, because our recovery systems and the way we seamlessly swing into them that defines us as a business that cares unconditionally about our customers. And while the customer, as I said, might complain about the service defect that just happened, they'll be in awe at the way our business handles that defect through its service recovery process. The other thing that we need to do is we need to be collecting secret service information about our patients, and this is simply defined as the implementation of hidden systems that enable our staff to consistently exceed the client's expectations and to make the client feel welcome, comfortable, important, and understood. Now, I haven't seen a dental manual where that's ever mentioned. Make the client feel welcome, comfortable, important, and understood. Everything we did in my practice was based upon that. Make the patient feel welcome, comfortable, important, and understood. Mary Kay Ash said it years ago. She said simply, people are walking around with an invisible sign around their neck that says, "Make me feel important." And we forget about that. We're more focused on our setups. We're more focused on getting the patient out quickly so we can get the next patient in quickly without making the patient feel important. And people say to me, "David, what's the one big thing?" And I say simply, there is no one big thing. It's about everything. You've got to make sure that you're doing everything right, but you've got to make sure that you're doing it in a system. If you're going to be cooking a great meal, you don't have 4 different recipes in front and trying to work out which one's best at which part of the ingredient. You've got to follow one system. So don't start putting it together bit by bit, because you're just going to end up confused. You want to hit that ball sweetly down the middle with one coach. So I said at the start that I'll try and give you as much as I can in the time that we have available. And I know we're at the end of the information, but I did promise that I'll show you where to get more information. So with your permission for a few minutes, if that's okay, I'll just explain about how you can get some more information. So thank you for indulging me for a couple of minutes. So right now, you're probably asking yourself, how can I implement the ultimate patient experience simply and easily into my dental practice so that my practice has a distinct point of difference compared to other practices in the area? Remember, my practice, I was doing 1.8 million with my own hands, and with the associates and the hygienists, we were doing $3.3 million. And yet the dental practice, I had a dental dentist 2 doors down the road, ground floor on one side. I was the 3rd floor up. And on the other side, 2 doors down the road, another ground floor guy who charged $1,500 a crown, and I was charging $2,300 a crown. And I was doing lots of crowns for baby boomers who wanted to keep their teeth. So how did I do it? I had a distinct point of difference compared to other practices in the area.